Let's do a quick overview now of pancreatitis, as this is one of the topics that you'll be asked to recall for the upcoming quiz. Pancreatitis is an inflammation of the pancreas, and we know that this gland hides behind the stomach and produces the digestive enzymes that are necessary, as well as some hormones that are necessary to help break down food and process nutrients. And so the gallstones that some people experience are most commonly the cause of pancreatitis. However, patients that are abusing alcohol, um, even patients with high triglycerides, these patients may also experience pancreatitis. Other risk factors are traumas, specific medications, and also genetic factors as well. And what your patients are going to first complain about is severe upper abdominal pain. Sometimes it can be actually radiate to the back. Patients with pancreatitis may also experience nausea, fever, vomiting. They may even feel bloated, very tender around the abdominal area. They might complain of diarrhea or even constipation. If it starts to affect their liver as well, you might see jaundice um, because we are now interfering with liver processes. And there are two types of pancreatitis, there's acute and there's chronic. Of course, acute also always means sudden onset, and this will come with severe inflammation. But with patients with chronic pancreatitis, this happens in a more long term way where there is inflammation that is causing a recurrent pain and the other symptoms that were described earlier. So, what are you going to do to help your patient to discover if it is indeed pancreatitis? And what are we going to do to treat? Well, of course, do a comprehensive physical exam. You may run some blood tests, which I'm just going to ask you about in just a second, and get some imaging tests as well. So, right now, my first question is, well, what type of diagnostics are best for acute pancreatitis? Now, getting a serum amylase or a lipase tends to be a very good thing. And what you're looking for are elevated levels. However, this is important. Lipase is going to be more specific for pancreatitis compared to just the amylase. But what is going to be even more sensitive and specific is a CT scan. Highly accurate for assessing the severity and complications of pancreatitis. But we always start with getting labs first, less invasive and less costly. We can also order an ultrasound because if it is because of gallstones, which again are one of the most common causes of pancreatitis, we can pick that up with an ultrasound as well. Now, going back now, then, let's say we finally have made our diagnosis. What are we going to do as treatment? Well, fortunately and unfortunately, we can prescribe some pain relievers, but resting the pancreas is going to be perhaps one of the most important things. So, resting by meaning avoiding food and alcohol and other triggers that have caused a pancreatitis in the first place. You may need now, because you are making your patient NPO, you will need intravenous fluids and other forms of nutrition or IV nutrition. In severe cases, surgery may be warranted, um, especially if you need to remove gallstones. What are the complications? Infection, bleeding, organ failure, and even in the most severe cases, death as well. So, again, really important to encourage your patient to reduce their triglyceride levels, to avoid alcohol in excess, and really to maintain a healthy lifestyle overall. And if it is their gallstones, they need to manage those gallstones promptly and work with their providers to help reduce the risk of um, recurring cholecystitis or recurring gallstones. Now, additionally, supportive care, self care should also be something that you talk about with your patients, and the possibility for hospitalization if you haven't had that talk with them yet. Okay, I'll see you on the next video.